You are tuning in to AWANI Tonight with me, Farhana Sheikh. There will be no cutting of queues in the COVID-19 National Immunization Program, assures Noor Hisham. And Deportation of Myanmar National, what is the fate of the remaining migrants? That's coming up. Malaysia has recorded 1,924 new COVID-19 cases today, the first time that the number has fallen below 2,000 since January 4th. The virus has claimed 12 more lives, bringing the total number of deaths from the virus to 1,100. However, it was reported yesterday that Malaysia's COVID-19 infectivity rate has gone back up. According to Health Director General Tan Sri Dr. Noor Hisham Abdullah, the basic reproduction number, or R0, stood at 0.99 as of yesterday. The R0, which measures the infectivity rate, went up yesterday from 0.95 and 0.96 in the 3 days prior to that.
The last time the rate was that high was on February 5th. Dr. Noor Hisham also indicated that Negeri Sembilan now has the highest rate among all the states, standing at 1.8. The second highest is Perak, followed by Sarawak, Kelantan, Penang and Kedah. The R0 projects the average number of people that each new COVID-19 patient will infect and must be below 1 so as to suppress further COVID-19 infections.
The Health Ministry has affirmed that there will be no cutting of queues in the distribution of the COVID-19 vaccine under the National Immunization Program. Health Director General Tan Sri Dr. Noor Hisham Abdullah said COVID-19 jabs will be given according to priority, which begins with healthcare frontliners and vaccinators.
He clarified today that 3 supposed influencers reportedly at the head of the line to be vaccinated against COVID-19 at Hospital Serdang are in fact clinical department heads. This is in response to a report by Malaysia Terkini news portal that influencers are included in the first batch of COVID-19 vaccine recipients tomorrow, ahead of frontliners. While no names were revealed, some readers interpreted it to mean non-medical personnel.
The United Nations and the United States have joined human rights groups to criticize Malaysia after the government defied a court order not to repatriate a group of Myanmar nationals pending a judicial review. Activists say the group of over 1,000 include refugees, asylum seekers, women and children.
The group departed on Tuesday on Myanmar Navy ships from a military base in Lumut, Perak. Hours before the deportation, the Kuala Lumpur High Court ordered it to be temporarily halted to allow a legal challenge from rights group that had fiercely criticized the plan. State Department spokesman Ned Price said the US was concerned about the move and urged all countries in the region to halt any repatriation of Myanmar nationals until the UNHCR can assess whether these migrants have any protection concerns.
What should be our main concern when looking at this issue? We speak to Lilian Fan, co-founder and international director of Getaneo Foundation.
We need to remember that this issue is not actually about Myanmar. It's not only about Myanmar. It's really about the issue of protection of refugees and asylum seekers, and the fact that no country should be returning asylum seekers and refugees to a country where they would face persecution or face a risk to their lives. I think it's important to state that concerns that are being raised about the protection of asylum seekers and refugees in this particular deportation, as well as others, in the future, this is not a position against the immigration and a lack of acknowledgement about the mandate of the immigration and the role and responsibility that the immigration department has. I think that we need to be very clear that this is an issue about ensuring that the immigration department and the immigration procedures actually have adequate procedures in place to ensure that protection is put in place for persons of concern, persons who could be vulnerable.
The courts have ruled that only Parliament can make criminal law, but does it prevent the state from interfering in questions of private morality? That's coming up on Consider This. We'll take a short break. Stay with us.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 7.45 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan.
The World Health Organization estimate that suicide is the leading cause of deaths globally among 15 to 30-year-olds. A recent report by the Institute for Democracy and Economic Affairs, or IDEAS, and Relate Malaysia found that there has been an increase in youth suicide in Malaysia, but very little has been done to address the issue. In 2019, the World Health Organization estimates 512 youths died by suicide in Malaysia. 382 are males and 141 are females. However, these numbers do not tell the real story.
Basically, in Malaysia, there's a lack of comprehensive data on the prevalence of suicide in general. The numbers that we have are also underestimates of the true rate of suicides, and this is mostly due to underreporting of suicides. Our society, we associate a lot of stigma with suicide, so often families would prefer not to disclose the cause of death. So a lot of the suicides are actually often reported as undetermined.
Befrienders Kuala Lumpur, which offers suicide helpline service, estimates that 33% of people reaching out for their help are 30 years old and below for 2019. They fear that the pandemic has fueled a rise in suicide attempts as there have been more distress calls during the first and second MCO.
The fear of not knowing how am I going to handle the future, for example, the fear of what is going to happen. This can make someone feel very anxious as well. So we do have many callers who are struggling with this. Apart from that, also feelings of loneliness, because nowadays you don't get to move around as free as before. Less physical contact with family members, with friends. So this have caused some of our callers to feel very lonely as well. Yeah. And then we also have callers who are struggling with financial issues due to loss of income. Last but not least, I guess those who are having pre-existing mental health condition, with the MCO, the CMCO as well, some of them have actually experienced disruption in their treatment, in their therapy session.
In tackling youth suicide, Vice Navu suggests a whole-of-society approach to strengthen support system for suicide prevention.
We really need a whole society approach to preventing suicide. So in the educational setting, young people are dealing with the shift to online learning, reduced interactions with their peers. So interventions for this age group needs to come from the sort of school and community setting. For working adults, support systems need to be in place within the workplace. So developing and implementing relevant prevention guidelines in these settings will require multi-ministry engagement. Besides that, since the start of the pandemic, you have NGOs who have been playing a very key role by providing psychosocial support on the ground, online, mostly online, and Ministry of Health unfortunately is already facing capacity issues due to the rise of COVID-19 cases. Therefore, the government could consider channeling some resources to existing NGOs to boost their services during the pandemic. And finally, we do need to decriminalize suicide to reduce stigma and improve help-seeking behavior, and also revive the National Suicide Registry to have a more accurate understanding of the prevalence of suicides in general, especially youth suicides, and risk factors to better target interventions.
As for those who are struggling, Kenny's message is clear: help is only a phone call away.
it's okay to be struggling, especially in difficult times like this here. What is important, or what is more important, is that to be able to practice self-care and to reach out to someone that you can trust if you feel like you need someone to talk to, because sometimes, you know, talking about the issue brings relief. If you feel like there is no one that you are comfortable enough to talk to, you can always, you know, call a helpline like the Befrienders KL, where the service is free of charge, and when you talk to our volunteers, you will not be judged. It's a safe place for you to talk about anything at all. Just know that there is help that's available, and do consider reaching out.
On to international news. Indonesia will receive at least 2 million doses of coronavirus vaccine produced by China's Sinopharm for use in a private vaccination scheme. Its Chief Investment Minister Luhut Panjaitan said the scheme is due to run alongside a national immunization program.
Indonesia, which has faced one of the biggest COVID-19 outbreaks in Asia, aims to vaccinate 181.5 million people within about a year, using vaccines made by companies such as Sinovac Biotech, Novavax and AstraZeneca. The private plan has been pushed by Indonesian business as a way for companies to buy vaccines from the government so that their employees can be vaccinated in order to help prop up the country's battered economy.
6 people were killed after an illegal gold mine collapsed in Indonesia. It is estimated about 22 people were trapped in the rubble when the mine in central Sulawesi collapsed late Wednesday due to unstable soil. Rescuers were able to pull 15 people from the debris and recover the bodies of 3 women during a grueling search effort until Thursday morning. Illegal mining operations are commonplace in Indonesia and the scene of frequent accidents. Facebook today has banned Myanmar's military from using its platform with immediate effect. The ban also applies to Instagram, which is owned by Facebook. Besides removing Myanmar Army's main page, Facebook has banned all military-linked commercial entities from advertising. The social media platform has already banned several military-linked accounts since the coup, including army-controlled Myawadai TV and state television broadcaster MRTV. Meanwhile, supporters and opponents of Myanmar's military clashed on the streets of Yangon earlier today after about 1,000 supporters of the junta gathered for a rally protected by lines of police. Anti-coup demonstrations continued for the 3rd week across the country. Protesters demand the release of civilian leaders and a return to democracy. That is all we have for you on AWANI tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I'm Farhana Sheikh. We'll see you tomorrow.